A patient walked into my office last spring. 63 years old, recently retired. She'd planned this whole next chapter of her life. Travel, grandkids, finally taking the dance class she'd put off for 30 years. And she sat across from me and said, almost in a whisper, "Dr. Jocelyn, I've stopped going places. I can't make it through a movie without leaking. I sneeze and I'm wet. I've started wearing pads every day and I'm only 63. Is this just my life now?" She is one of millions. And what I want to tell you, and what I want every woman over 50 watching this video to hear, is no. This is not just your life now. This is your bladder and your pelvic floor and the tissues around your urethra asking for something specific. And in many cases, they're asking for something you can put on your plate this week. I'm Dr. Jocelyn. I'm a urologist, and I've spent over 20 years caring for women in exactly this situation. Bladder health is one of the most under-discussed parts of women's medicine, and I think that's a quiet tragedy, because the shame around it keeps women silent, and the silence keeps them from getting help. So today I'm going to walk you through 5 foods that genuinely support bladder control as you age, 3 foods that are very likely making your symptoms worse, and the simple framework I give every patient who comes to my clinic with this exact concern. But before we go any further, hit subscribe and turn on the bell. Every week on this channel, I cover the things women your age aren't getting from a 6-minute appointment. Bladder health, pelvic floor, hormonal changes, the urological side of menopause, all of it. The information you wish your mother had been told. And drop a comment with where you're watching from. I love seeing the global community of women who are tired of being told this is just aging. Now let me explain what's actually happening in your body. Because once you understand the mechanism, the food choices make sense. What's going on down there? Think of your bladder as a balloon and your pelvic floor as the hammock of muscles holding that balloon in place from below. The urethra, the tube that carries urine out, runs through that hammock. For most of your life, that hammock is firm, the bladder wall is elastic, and the urethral tissue itself is plump and well-sealed because of estrogen. Then perimenopause and menopause arrive. Estrogen drops. And here's what almost no one tells women. Estrogen receptors are densely packed in the tissues of the urethra, the bladder neck, and the vaginal wall. When estrogen falls, those tissues thin. The urethra doesn't seal as tightly. The pelvic floor weakens, sometimes accelerated by past pregnancies and births. The bladder wall becomes more irritable, more prone to spasms, more likely to send "I have to go right now" signals when it's only half full. That's the picture. 2 main types of leaks come from it. Stress incontinence, leaking when you cough, sneeze, laugh, or lift. That's mostly a pelvic floor and urethral support issue. And urge incontinence, that sudden, panicked feeling of needing a bathroom right now, sometimes followed by leaking before you make it. That one is mostly about an irritable bladder muscle. Most of my patients have a mix of both. Most women over 50 do. Now, what you eat changes both of these. Not as much as people sell you on Instagram, but more than your last doctor probably told you. Let's go through it. Food number 1, pumpkin seeds. Pumpkin seeds. Specifically the unsalted, raw, or lightly roasted kind. Not the candied ones at the grocery store with sugar coating them. Here's why I put these first. There's a body of research going back over 15 years looking at pumpkin seed extract in women with overactive bladder symptoms. The mechanism appears to involve a compound in the seed oil that supports the smooth muscle of the bladder, helping it relax instead of spasming. And separately, pumpkin seeds are one of the richest plant sources of magnesium, which plays a role in normal muscle function throughout the body, including the pelvic floor. I had a patient, I'll call her Maureen, retired nurse, 68, lifelong bladder issues that had gotten significantly worse after menopause. She told me she'd tried everything. I asked her if she ate pumpkin seeds. She laughed at me. I asked her to humor me. A small handful every day with breakfast. 6 weeks later, she came back and told me her urgency episodes had dropped by more than half. Was that the seeds alone? Probably not entirely, but it was the first thing in years that moved the needle for her. How to use this. A small handful, about a quarter cup, once a day. On yogurt, on a salad, in oatmeal, or just out of the bag. Buy unsalted. Sodium pulls fluid into your bladder, which is exactly what we don't want. Food number 2, pears. Pears. Plain, simple, ordinary pears. Here's the thing about bladder irritation that almost no patient has been told. The lining of the bladder is sensitive to acidity. When the urine sitting in your bladder is more acidic, it irritates that lining and triggers the urgency signals that send you running to the bathroom. Many women with overactive bladder are walking around with chronically acidic urine because of what they're eating and drinking: coffee, citrus, tomato sauce, soda, wine. Pears are one of the few fruits that are both alkalizing and gentle. They don't irritate the bladder the way oranges, grapefruit, or pineapple do. They're rich in soluble fiber, which matters more than people realize, because chronic constipation is a hidden driver of incontinence in older women. A backed-up colon presses on the bladder and weakens the pelvic floor over time. Pears help with both. A patient I'll call Diane, 71, had been suffering with what her previous doctor diagnosed as just an old lady bladder. Her diet was full of orange juice in the morning, tomato-based soup at lunch, and a glass of wine at night, 3 of the worst bladder irritants in existence. We swapped her morning orange juice for a ripe pear and a glass of water, and switched her lunch soup for something cream-based instead of tomato-based. The wine, we negotiated. Within 3 weeks, she told me her nighttime trips to the bathroom had gone from 5 to 2. How to use this: 1 ripe pear a day. Eat the skin, that's where the fiber is. If they're hard at the store, leave them on the counter for 2 days. A hard pear is a sad pear. Food number 3, wild-caught salmon or a good omega-3 source. Salmon, sardines, mackerel, or if you don't eat fish, walnuts and ground flaxseed. The omega-3 family. Here's the part that surprises women. Bladder health is, in part, an inflammation problem. The thinning of urethral and vaginal tissue after menopause is accompanied by low-grade chronic inflammation in the pelvic region. And one of the most consistent findings in nutrition research is that omega-3 fatty acids, EPA and DHA specifically, reduce systemic inflammation in measurable ways. There's also growing evidence that omega-3s support the integrity of mucosal tissues, the kind of tissues that line the urethra and bladder. Beyond that, there's the muscle piece. The pelvic floor is muscle, and like all muscle tissue, it depends on adequate protein and adequate fat to maintain itself. After 50, women routinely undereat both. A piece of salmon delivers protein, omega-3s, and vitamin D in one plate. I had a patient, early 60s, marathon runner her whole life, frustrated that her stress incontinence was getting in the way of her training. We didn't change her exercise, we changed her plate. Salmon twice a week, walnuts as a snack, ground flax in her morning yogurt, plus a serious pelvic floor program with a women's health physical therapist. 3 months later, she ran a half marathon without changing her pad once, for the first time in years. How to use this: 2 servings of fatty fish a week, ideally wild-caught. If fish isn't your thing, 2 tablespoons of ground flaxseed daily and a small handful of walnuts most days will get you in the right neighborhood. Food number 4, bone broth and collagen-rich foods. Bone broth. Slow-cooked stews with meat on the bone, skin on chicken thighs, chicken feet if you're brave, anything that delivers collagen to your body. This one is recent, and I'm careful with it because the research is still emerging, but I think it's worth your attention. The pelvic floor and the supporting tissues of the urethra are made largely of collagen. As estrogen falls in menopause, your body's ability to manufacture and maintain collagen drops sharply. That's why your skin changes, your joints ache, and yes, the support structures of your pelvis weaken. Multiple studies in the last decade have shown that hydrolyzed collagen supplementation improves skin elasticity, joint comfort, and tendon health in postmenopausal women. The pelvic floor connective tissue is made of the same material. Now, I want to be honest with you. I do not have a randomized trial on my desk that proves bone broth fixes incontinence. I do not. What I have are decades of clinical observation, sound biological reasoning, and patients who have added collagen-rich foods to their diet and noticed their tissues, all of their tissues, feel more supported. A patient I'll call Frances, 74, had mild prolapse and stress incontinence. She started making a big pot of bone broth every Sunday and drinking a cup most mornings. Combined with pelvic floor therapy, 8 months in, her surgeon told her the prolapse had not progressed, and her symptoms were noticeably better. Was it the broth? Probably part of the picture, but she's a believer, and I'm not going to argue with her. How to use this: a cup of real bone broth most mornings, in place of or in addition to your tea. If you don't want to make it, get the kind from the refrigerated section. not the shelf-stable kind, which tends to be mostly salt water. Or a daily scoop of unflavored hydrolyzed collagen powder in your coffee. It dissolves clear, doesn't taste like anything, and gives you about 10 grams of protein on top of everything. Food number 5. Dark leafy greens, especially kale and Swiss chard. I know, greens. The advice every doctor gives. But hear me out, because this one is specific. For bladder health after 50, the 2 minerals that matter most from your diet are magnesium and potassium. Magnesium calms the smooth muscle of the bladder wall, the same muscle that misfires in urge incontinence. Potassium supports the broader fluid balance in your body, which keeps your bladder from being overworked by erratic fluid shifts. Dark leafy greens are one of the few foods that deliver both, in significant quantities, in a low-calorie package. There's also a vitamin K piece that doesn't get talked about enough. Vitamin K supports tissue integrity throughout the body, including the connective tissues of the pelvis. Greens are loaded with it. The trick is getting them in. Most of my patients tell me they don't really like salads, and I tell them I don't really care. Sauté a bunch of chard in olive oil with garlic and have it as a side dish. Throw kale into a soup. Blend baby spinach into a smoothie where you can't taste it. The form matters less than the consistency. A patient, late 50s, busy executive, no time and no patience, told me she'd never eat greens. We compromised on a daily smoothie with frozen banana, frozen mango, a big handful of baby spinach, and a scoop of protein powder. She drank it on her commute. 6 weeks of that, plus a few other small changes, and her urgency episodes were significantly down. How to use this. Aim for 2 servings a day. A serving is 1 cup raw or half a cup cooked. Vary the greens. Kale one day, spinach the next, chard, arugula, collards. Different greens have slightly different nutrient profiles, and rotating gives you all of them. The 3 foods you need to stop eating tonight. I promised you 3. Here they are, ranked by how much trouble they cause my patients. Number 1, caffeine. Coffee, black tea, green tea past 2 cups, and anything with added caffeine. Caffeine is a direct bladder irritant and a diuretic. It drags fluid through your kidneys faster, and the metabolites of coffee specifically are inflammatory to the bladder lining in many women. If you want to do one thing tonight that improves your symptoms by next week, cut yourself down to 1 cup of coffee in the morning, before noon, and switch to water or herbal tea after that. The women who do this, and only this, often see meaningful improvement within 2 weeks. Number 2, artificial sweeteners. Aspartame, sucralose, saccharin, the diet soda crowd. These are some of the most consistent bladder irritants in the literature, and yet so many of my patients are drinking diet sodas all day long, thinking they're being healthy. If you're drinking diet soda, that is very likely a major source of your symptoms. Real sugar, in moderation, is paradoxically gentler on the bladder than these chemicals are. Number 3, spicy and acidic foods, in combination. A little hot sauce now and then is fine, but the women I see with the worst symptoms often have a daily pattern. Coffee in the morning, tomato sauce or salsa at lunch, citrus through the day, wine at night. Any one of these is tolerable. All 4 together, every day, is a daily inflammation bath for a bladder lining that's already thinner than it used to be. Pick your battles. If you love your morning coffee, fine, but cut the citrus. If you love wine with dinner, fine, but skip the tomato sauce that night. When food isn't enough. I want to be honest with you because honesty is what you deserve from anyone with a white coat. Food alone will not fix moderate or severe incontinence. It will help. It is part of the picture. But 3 more things matter at least as much and probably more. 1. Pelvic floor physical therapy. Not Kegels you do on the toilet. Real, supervised pelvic floor therapy with a specialist. This is the single most underused treatment in women's health. Ask your doctor for a referral. If they don't give you one, ask another doctor. 2. Vaginal estrogen, if appropriate for you. This is a low-dose, locally applied estrogen. It does not carry the same risks as systemic hormone therapy, and for many women over 50 with thinning urogenital tissue, it is genuinely transformative for bladder symptoms. Talk to a urologist or a urogynecologist about whether you're a candidate. Too few women are offered this. 3. Strength training. 2 days a week, full body, with weights that actually challenge you. Strong glutes, strong core, strong back. These all support the pelvic floor in ways that have nothing to do with the pelvic floor directly. The women who come to my clinic in their 70s who have minimal incontinence are almost always women who have kept lifting things. The quiet part no one tells you. Here is what I want every woman watching this to take with her. The shame around this is the cruelest part of it. Women hide it from their husbands. They hide it from their friends. They stop traveling. They stop dancing. They wear black pants every day. They turn down dinner invitations because they're worried about the bathroom situation. And they suffer in private because somewhere along the way, someone made them feel like this was theirs to be embarrassed about. It is not. It is a medical condition with medical causes and medical solutions, just like high blood pressure or thyroid disease. You would not be ashamed to take medication for your blood pressure. There is nothing to be ashamed of about your bladder. Your body is not betraying you. It is asking for what it needs. Estrogen support, stronger muscles, less inflammation, better fuel, and most of all, your attention. Give it those things and you will be astonished at how much of your life comes back. Closing. If this video told you something no one else has told you, hit the like button. It's how this kind of information reaches the women who need it, the ones suffering quietly because no one is talking about this. Drop a comment and tell me what changes you're going to try first. I read every single one of them and I often respond. Subscribe to the channel and turn on notifications because next week we're going deeper. I'm covering vaginal estrogen and exactly how to talk to your doctor about whether it's right for you, including the question that, in my experience, gets you the best answer. Send this video to your sister, your mother, your best friend. There is a woman in your life right now who is suffering with this in silence. Be the one who finally hands her the information. I'm Dr. Jocelyn. Take care of yourselves. Your best chapters are not behind you. I'll see you in the next one.